appreciate the opportunity to have a little bit of time with you to talk with you about what's going on. So Jayci Knights, I'm the Chief Medical Officer here at Camp Care. My background is I have been an OBGYN for the last 20 years in the Camden community. And my passion is taking care of people who are underserved and leading through policy and quality initiatives to change things and improve things on the ground for people who are classically underserved. %100% yes. The flu vaccination is tried and true, and we know that to be a way to diminish the amount of influenza within the community. Why that's important? Because a certain percentage of our community is hospitalized every year with influenza illness. And as you know, the hospitals cannot handle any more people requiring high intensity care right now as they are focused on COVID. So that's one reason. The other reason is because when you have influenza, many of the symptoms mimic COVID, and so it's very difficult to tell between COVID and influenza whether we should be getting you to a hospital or whether you should be going home and enjoying mom's chicken broth. So it is really important to make sure that we take away the guessing out of the picture and make sure that you are vaccinated. We know we have long decades of history with influenza vaccine. It works well. It does not cause any side effects, so there are only ups to receiving the influenza vaccine. So definitely you should get your influenza vaccine. Yes, we have influenza vaccine clinics between 10 and 12 every day. You can walk in or you can call and schedule an appointment to get your flu vaccine. And we are happy to have you and see you and give you your influenza vaccine. There are 2 vaccines that are looking to come to the United States. One is by Pfizer and one is by Moderna. The Pfizer vaccine is going to be reviewed by the FDA tomorrow, so we are all excited for this momentous event. This is a full year coming, and we have been working on this vaccine because we see it as instrumental in helping to move us from pandemic to the other side of normalcy. So when we have a limited supply of vaccine, it's important to prioritize who has first access to the vaccine. As such, the CDC has recommended that frontline healthcare workers be the first to receive the vaccine. And that is simple. These workers are seeing patients in and out of facilities every day, and we don't want our healthcare workers to give you COVID. So we want to make sure that they are vaccinated and we prevent them from getting the virus. And then they are less likely to give it to you when you come to visit the medical facilities. The second round of this is for members, for residents of long-term facilities like nursing homes. And that's because it is so difficult in the nursing facilities to prevent transmission of COVID. So once one person has it, it spreads like wildfire and it's very hard to stop it. So they have been identified as the second group to receive the vaccination. So it looks like the rest of us will receive the vaccine, will have the vaccine available in the springtime. And that's a round estimate based on what the vaccine companies are talking about and how many doses they're able to produce. Yes, we are excited, and we are in line to receive the COVID vaccine when it's ready. And we have plans to be out in the community, as we've been out in the community all summer, all fall, and continue in the winter. We're going to continue with our activity in the community to provide the COVID vaccine to those who are medically vulnerable and to those who want the vaccine. Great question. So the COVID vaccine is administered by a medical personnel, and it is given by injection, similar to the flu vaccine. The companies that are producing the COVID vaccine are requiring 2 separate doses. So you would get your vaccine today, and then you would have to come back a couple of weeks later to get the second dose. So it's a 2-dose vaccination plan. So that is a great question, and it's something that we're all thinking about, right? If I decide to take it, what's going to happen to me? And to be sure, some percentage of people who receive the COVID vaccine will receive mild injection symptoms, muscle aches, a low-grade temperature, just not feeling the best. And that's a small percentage of people who get the vaccine. It usually happens the day after the vaccine. This also can happen when you get your influenza vaccine. It also can happen when you get your measles vaccine. This is one of the things that we deal with vaccination. And it is not you getting COVID, it's not you getting the flu, it is your body's way of responding to what we've done. So that's actually your immune system accelerating and dealing with what we've put in front of it. And we actually count that as a positive sign that we've been able to stimulate your immune system to fight the disease that we're trying to prevent. Another great question. So it is unknown. That's the first thing I'll say. It is unknown. What we know is that it looks like it's going to be a long period of time, years versus months. And that's based on previous studies with this type of technology. So it looks like it's going to last a couple of years. The specifics of that we'll get more of, and that's what we need to find out on the back end. But it does look like it's going to last some time. And I do want to take the moment to talk about, some people are questioning, well, if I just get COVID, then I'll just be immune forever and then I don't have to get the vaccine. And I just want to make a note that we do know for sure that once you get COVID, the immune response to COVID is on the order of months, not years. There have been multiple people who have been reinfected both in China and here in the United States. It looks like a couple of months your immunity lasts. And so that's the difference between getting vaccinated and having the disease itself. So we do want to be careful about that, because getting sick from COVID does not then mean that you can never get sick again. It doesn't mean that at all. Great question, and I'm glad you asked. I know in our community there are lots of questions about Operation Warp Speed and how we came to have a vaccine so quickly. People are afraid that it was rushed or not looked at, or that we are looking for more test subjects. And I do want to let you know that I am in favor of this vaccine. I have listened to the experts. I have looked at the data provided by Pfizer and Moderna, and also listened to Dr. Fauci. And I think that it is clear that we have a decision to make. COVID is going to be here for a little bit, and we know that there's a certain amount of people, a certain percentage of people who will get very sick. And even if you don't get very sick from getting COVID, you could pass it on to somebody who could die from having COVID. And in addition to all of our measures to help decrease the risk, this is one additional thing that can really help us turn the tide and get back to our way of life, to get back to 2019, how we were. So to answer your question, yes, I'm going to be taking the vaccine. I am, because I want, not only for me, but I want to protect my husband, and I want to protect my baby who can't get it yet. I want to protect my mom. I want to protect my mother-in-law. And these are people who aren't able to get the vaccine yet. I feel very strongly that as COVID-19 ravages our community, that we need to look to alternatives to help us get control of it, and the vaccination is one such thing.
Can you pause for a second?